If you or someone you know is one of the millions of people taking metoprolol to manage high blood pressure or other heart conditions, then it's essential to know what to avoid to ensure the best results. Let's delve into one of the most frequently asked questions about metoprolol, the specific medications and dietary choices to avoid. Understanding these can help you navigate your treatment with caution and attention. Metoprolol belongs to a class of medications known as beta blockers, and it plays a crucial role in managing various cardiovascular conditions. Available under the brand names Lopressor and Toprol XL, it's designed to address issues like hypertension, angina, and heart failure, proving its versatility in heart health. Its application extends beyond these primary uses, offering preventative benefits against migraines and serving as a proactive measure to diminish the chances of experiencing subsequent heart attacks. Metoprolol acts on the beta, one adrenergic receptors in the heart, and reduces the effects of catecholamines, such as adrenaline and noradrenaline, on cardiac function. It can be taken alone or in combination with other medications to manage hypertension and angina effectively. However, individuals taking metoprolol might experience a range of effects, with the more commonly reported side effects are tiredness or fatigue, dizziness or lightheadedness, occasional nausea, and icy hands and feet. These symptoms are typically mild and may diminish as the body adjusts to the medication. But in this video, we will explore the medications and dietary choices to avoid if you're taking metoprolol. This video is for educational purposes only, so speak to your doctor if you have any medical concerns. Number 1. Alcohol consumption. Alcohol's interaction with metoprolol can significantly enhance the medication's blood pressure lowering effects, potentially leading to adverse reactions such as heightened dizziness, an increase in lightheaded sensations, and even episodes of fainting. These effects are primarily due to alcohol's ability to dilate blood vessels, which, when combined with metoprolol's mechanism of reducing heart rate, can result in a dramatic decrease in blood pressure. This reduction is more pronounced in situations of moderate to heavy alcohol intake. Consequently, individuals taking metoprolol are advised to either abstain from alcohol or consume it in minimal quantities. Engaging in a dialogue with your pharmacist can help establish safe consumption levels, if any, based on individual health status and treatment goals. Number 2. Decongestants. Decongestants are often reached for during cold and allergy seasons, offering quick relief from nasal congestion. However, for those taking metoprolol, these seemingly benign over-the-counter remedies can pose significant risks. Active ingredients in many decongestants, such as pseudoephedrine and phenylephrine, act as stimulants that can increase heart rate and elevate blood pressure. This effect directly opposes the action of metoprolol, designed to lower heart rate and blood pressure as part of its therapeutic effect in managing heart conditions. The interaction between decongestants and metoprolol can undermine the control of hypertension or other heart-related conditions, leading to potential complications. For instance, an unexpected rise in blood pressure due to decongestants can increase the workload on the heart, possibly negating the benefits obtained from metoprolol. This scenario mainly concerns individuals with already existing heart conditions, where maintaining stable blood pressure and heart rate is crucial for their health. A consultation with a pharmacist is imperative before reaching for any cold or allergy medication. Antihistamines that do not contain pseudoephedrine and phenylephrine may be a safer option for alleviating allergy symptoms without adversely affecting blood pressure or heart rate. Additionally, saline nasal drops or sprays may be recommended as non-interacting options for nasal congestion relief. Number 3. High-potassium foods and supplements. Careful consideration of dietary potassium intake is essential for individuals on metoprolol therapy. Metoprolol can cause the body to retain potassium. This retention can lead to hyperkalemia, a condition characterized by elevated potassium levels in the blood, which can be dangerous and potentially lead to cardiac issues. High-potassium foods such as avocados, sweet potatoes, spinach, and certain types of beans, while generally considered healthy, may need to be consumed in moderation. Similarly, Potassium supplements, often taken for various health reasons, should be used cautiously. Number 4. Grapefruit and grapefruit juice. They consume grapefruit or grapefruit juice while on metoprolol, which is strongly discouraged due to their significant interaction. When ingested grapefruit, it can inhibit the enzyme called CYP2D6, which metabolizes metoprolol. This inhibition leads to a higher concentration of the medication in the bloodstream than intended. As a result, individuals may experience an amplification of metoprolol's side effects, such as increased dizziness, a more pronounced feeling of lightheadedness, and an excessive drop in blood pressure. These heightened effects can cause discomfort and risk one's overall health. To maintain the balance and effectiveness of metoprolol therapy, it is advisable to steer clear of grapefruit and products containing grapefruit juice. Number 5. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, more commonly known as NSAIDs, have a well-documented interaction with metoprolol that patients should be aware of. Medications such as ibuprofen and naproxen, widely used for their pain-relieving and anti-inflammatory properties, can inadvertently counteract the benefits of metoprolol. Specifically, NSAIDs can reduce the effectiveness of metoprolol in lowering blood pressure, potentially complicating the management of conditions like hypertension and heart failure. The interaction between NSAIDs and metoprolol is multifaceted. NSAIDs can impair the body's ability to excrete sodium, leading to fluid retention. This process can elevate blood pressure, which directly opposes the blood pressure lowering goal of metoprolol therapy. Additionally, NSAIDs can blunt the vasodilating effect that beta blockers like metoprolol are meant to induce, further hindering the control of blood pressure. Another significant concern is the potential for NSAIDs to exacerbate kidney problems, a risk that increases when combined with medications like metoprolol. People with cardiovascular conditions often have compromised kidney function, and the added strain from NSAIDs can lead to worsening kidney health. Number 6. High sodium foods. Consuming foods with high sodium levels can lead to water retention and a consequential rise in blood pressure. This outcome directly opposes the blood pressure lowering effect metoprolol aims to achieve. To maintain the intended benefits of metoprolol, individuals should consider adopting a low sodium diet. This involves being mindful of the sodium content in everyday foods and opting for fresh, unprocessed options whenever possible. Foods notorious for their high sodium content include canned soups, deli meats, and certain condiments. Reading labels and choosing alternatives with lower sodium levels can significantly impact blood pressure management. Number 7. Certain antidepressants. Combining antidepressants with metoprolol can present a challenging scenario for individuals managing heart conditions. Antidepressants, notably SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, citalopram, sertraline, and tricyclic antidepressants, such as amitriptyline, imipramine, have the potential to interact with metoprolol in a way that may heighten the risk of experiencing pronounced side effects. One of the main concerns with this combination is the increased possibility of encountering low blood pressure, hypertension, and a reduced heart rate, bradycardia. These conditions can exacerbate the symptoms of heart-related issues. The mechanism behind these interactions involves the influence of antidepressants on the body's metabolic pathways that process metoprolol. By inhibiting these pathways, antidepressants can lead to elevated levels of metoprolol in the bloodstream, thereby intensifying its effects. Number 8. Calcium channel blockers. Calcium channel blockers and metoprolol, when taken in tandem, pose significant health risks due to their profound effects on the cardiovascular system. Both types of medication work to lower blood pressure, but their combined effects can lead to shallow blood pressure, hypertension, and a markedly reduced heart rate, bradycardia. These conditions may manifest as symptoms including severe dizziness and fainting, compromising the individual's safety. Particularly concerning is the combination of metoprolol with verapamil or diltiazem, two specific calcium channel blockers known to affect heart rate and blood pressure significantly. Number 9. Antiarrhythmic drugs. Antiarrhythmic medications are designed to correct irregular heartbeats, but when paired with metoprolol, the interaction can complicate treatment. These drugs, including those like amiodarone and flecainide, when taken alongside metoprolol, could synergistically slow the heart rate more than intended, leading to bradycardia. Additionally, the risk of experiencing hypertension or even fainting episodes increases, which could pose significant health hazards. People treated with both antiarrhythmic drugs and metoprolol should undergo rigorous monitoring by healthcare professionals to detect any adverse effects promptly. Adjustments to dosages or medication plans might be necessary to safeguard against these potential risks. Thanks for watching. Managing your health while on metoprolol involves more than just taking your medication. It's also about making smart choices with your diet and lifestyle. Avoiding certain foods, beverages, and other medications can help metoprolol work more effectively and reduce the risk of unwanted side effects. Always consult with your pharmacist or doctor before making any changes. Stay informed, stay healthy, and see you in the next video.